Good morning, everybody. My name's David McCaleb with Bankers Insurance, and I want to welcome you to today's webinar on complying with OSHA's COVID vaccine mandate. And as you might have heard us just chatting, there have been a few changes recently. Today's webinar will be a little bit fluid. We're persevering through power outages and persevering through bus schedules, and we appreciate you guys being here, and I just want to extend a special welcome to our clients. If you are not a client, by all means, what's wrong? Let us know how we can help. And but welcome to everybody who's here. Little housekeeping real quick. The meeting is being recorded. There will be some time for Q&A at the end, but by all means, there are a couple ways you can interact with us during the webinar. One is through the chat function. And just go ahead, and there's a little speech bubble on the top. If you don't see chat, click on the speech bubble. You can type your question in there. The other way is to raise your hand. And now I'm going to try to, when you raise your hand, unmute you. And so this is the first time on a new format here. So be a little bit patient with me if I'm not able to get you unmuted right away. I know chat works, but either of those ways should work fairly well. So enough of that. I'd like to introduce our presenter today, Jamie Hasty, who's the Vice President at SESCO Management Consultants. Now, we've enjoyed a very long relationship with SESCO, and they're one of our key partners. They are a very strong tool, not only in our toolbox, but if you're a client of ours, they're a strong tool in your toolbox. And so SESCO has been providing human resource and employee relations consulting services actually since 1945, and not just here locally, but all over the country. So with that introduction, I will go ahead and pass it on over to Jamie.
Thanks, David. Good morning. It's good to be back. We try to do this each quarter. So bear with me as I am fighting the remnants of a cold. I apologize for that. So, we've been doing a lot of work with the OSHA ETS and all of the legal pieces that come with it. And so, if you are on the SESCO News Blast, we did a webinar a couple of weeks ago on the preparation for the OSHA ETS mandate for when employers that are 100, federal contractors, then healthcare workers. And I was telling David yesterday that actually ended up going almost 2 hours long. So, which is crazy, which is awesome, because we had so many questions. But because the requirements and regulations were so in depth, it took that long to get through a bulk of it. So since then, and really since right before Thanksgiving, there have been some movements which have changed how David and I are going to run today. So normally I would have a PowerPoint and we would be going through the specific requirements for 100 and healthcare and federal contractors. But we're going to roll this one more conversational, and I hope that's okay with you all. Certainly, I am happy to send out follow-up supporting documentation in writing like I normally do with forms and PowerPoints and all of that good stuff. So, when I talk with our clients throughout the country in every single industry, small mom and pop businesses all the way up to Fortune 100s, employers have been, David, they've been really, really struggling with this whole mandate piece, right? What do we do? Do we wait? Do we prepare? Do we implement? What should we be doing? And so our recommendation at SESCO has been, it's never going to hurt you to be prepared, okay? Yes, there are some things going on in the legal system. However, you cannot bank on the fact that a federal judge is going to overturn some of these mandates. So what you're seeing a lot in the news is obviously on the 100 employers, they have a federal stay on the OSHA ETS mandate. So what does that mean? That means the Fifth Circuit federal judge, and that is Louisiana, Mississippi, Texas, It was the same federal circuit that, if you recall, back in 2015, when we were doing some of the salary exemption, salary threshold increases. It's the same court system that put a stay on the Department of Labor, jacking up that guaranteed salary from $455 to, I think it was like $984 or something crazy. Anyways, moot point. So, same court system. They put a federal stay on it. And then, we got a ton of questions about, well, does this stay apply to all employers across the country in the 100 market, or does it only apply to the employers in the fifth district, the circuit, Texas, Louisiana, Mississippi, which is a fair question. And the way that the state was written didn't really expressly address either one. And so we have to look back at how have things historically been applied from a legal perspective when stays are issued. And so our recommendation was that it applied to everybody in the 100 market. Now, if you were a healthcare client or a federal contractor client, up until like 12 hours ago, maybe 18. Let's roll it up. Maybe 18 hours ago, healthcare clients, you still were required to comply if you were receiving reimbursement funds from Medicaid or Medicare. And there are about 21 different types of organizations carved out under that CMS ruling. Federally qualified health centers, ambulatory care centers, hospitals, nursing homes, home health, but only home health that is considered Medicaid home health, not private duty home health. So you get into the intricacies, David, you can see of who's really covered and who's not. So we've been getting a ton of questions about that, a ton of requests about, okay, how does this differ from maybe our voluntary policy that we've already had in place? There are a ton of awesome questions about, can we incentivize to get the vaccine?
Mhm.
What legal challenges do you run into with that? What do I do when somebody refuses because of personal beliefs, not just because of religion or medical certification? So, Adam Nicely at our office, who is our corporate attorney, many of you all may have chatted with Adam. He's fabulous. He's also one of the consultants or attorneys that you may access when you call SESCO if you have HR related questions, if you're enrolled in the program. So Adam and I have been quite busy. And in fact, he's working this morning very tirelessly on an update for our healthcare clients that need to be rolled out, because yesterday, late afternoon, and I would even roll into early evening, a federal judge did put a stay on the healthcare mandate. Okay.
Mhm.
Which is huge, which is huge. Um, so, especially considering that healthcare mandate was an executive order from the president, this is a big deal. Does that mean that you, if you are a healthcare client on the call today, that you immediately stop enforcing your vaccine mandate and all of that? No, that's not what I'm saying. Again, we are always going to recommend full compliance. But that means that now the court system is going to battle out whether that executive order was constitutional or not. And whether the healthcare organizations underneath that CMS rule are going to have to comply in order to get their funding. So it's an interesting, if you're interested in law, it really is kind of one of those, both cases are really kind of neat to watch unfold, and the complexities and the intricacies of where they're challenging the mandates and on what pieces of the law. So for example, with the regular employer mandate with 100 or more employees, they're looking at the constitutionality, but they're also looking at the ability of OSHA to define the emergency oversight piece, and whether or not that was overreach. So OSHA is hanging their hat on the fact that, this mandate is really based on an emergency response. and that there is grave danger with employers with 100 or more employees where they have to mandate it across the board. So when you look at the OSHA mandate for 100, there may be employees impacted by this mandate that have zero exposure to COVID, to other employees, to other things. And yes, there are carve outs for people that work from home and obviously for medical and religious exemptions. But again, a lot of these states, a lot of these employers, and the Sixth Circuit Appeals Court is going to be looking at, is this constitutional? To mandate something like that when the powers of OSHA are very, very narrowly defined, and then it bumps back up to congressional action. So it's, if you like law, it's really interesting kind of digging into how it all works. So that's kind of where we're at. We're kind of in a holding pattern right now. What I will say with the 100 mandate. So the Fifth Circuit judge issued this stay, and that was back in, I think it was November 6th. And then the week of November 10th or 12th, round about those days, because everything blends together now. We're in holiday season. So it's kind of like, what day did it occur? They did, and it's interesting. So they did a lottery system. So they did a lottery system of all of the court circuits that had received appeals to this 100 mandate. So there's 12 circuits throughout the entire country. They ended up with 10 circuits. And when I say it was a lottery system, it is like watching the Mega Ball on the morning show where they put in the ping pongs with the numbers, and it goes into that air thing, and then one pops up, and that's your winner. That's how they determined what circuit was going to hear this appeals case. And so we ended up with the Sixth Circuit judge or court system. And so I will say that if you look at how the Sixth Circuit is comprised, and it is what it is, it's factual. You've got roughly about there's more Republican judges than there are Democratic judges. Again, is what it is. It's how they're comprised. That too. So there will be a 3-panel judge that tries the case, that will work alongside, or hear rather, OSHA, Department of Labor's defense, and then of course the prosecution. So just like they picked the circuit to hear it, they're also going to pick the 3 judges from that circuit using a lottery system. Okay. So you could have all Republicans, you could have all Democrats, you could have 1 Democrat and 2 Republicans, or 2 Democrats. It's a free-for-all. Okay. So you're hearing a lot of positive things through the media outlets, through the business world, of the Sixth Circuit appeals is great for crushing the OSHA mandate. Okay. In theory, it very well could be. However, it might not. It might not be at all. So, what we're recommending to employers is that you've got these requirements. You've got these things that should be ready to roll, because if the Sixth Circuit Court upholds OSHA's mandate, you all need to be in compliance immediately. Okay. So they're not going to give a grace period because the mandate has already been issued. The mandate requires that by January 14th or January 4th that everybody be vaccinated, and they gave you pretty much 60 days to get your act together. Okay. So that's why I'm saying it is really, really important to have your policy and your procedure already written. Healthcare clients and then federal contractor clients will have separate requirements in the written policy. And we have sample policies. If you need those, just reach out. So, you need to have these things in place. I have a lot of clients that are already, um, already, receiving religious accommodation requests. You need to have procedure in place for that. You need to have forms ready to go, and have those things already out and rolling, so that, again, if we have to comply with the mandate, we've already approved these things, we've already gone through, and we have our documentation in place. So there's a lot of administrative work that's still going on that needs to occur. Do not bank on the fact that these stays are going to get us out of these mandates. And then you have clients that are coming from the perspective of, well, I don't really want to do the work unless I absolutely have to. And I can appreciate that. I can appreciate that a lot. But again, it's better to be compliant and, having done some of the administrative work up front to not need it versus potentially facing significant fines. I mean, these fines under the OSHA mandate start at around, $14,000 per day per incident. So yeah, it can add up really, really quickly. And let me be honest with you, if in fact OSHA does enforce this rule, if the stays are flipped, OSHA has the ability to mandate it, and they start enforcing it, they will check. They absolutely will check. I mean, if you're a Virginia client, you're familiar with Virginia ETS. That was the temporary standards that we had back in the spring of, oh my gosh, 2020. We've been in a pandemic for a really long time. Really long time. I heard somebody the other day, David, refer to it as junior year. We're rolling into junior year. And I was like, wow, okay, well, true. So anyways, if you're familiar, Virginia had an ETS. And so we had a ton of clients here in Virginia, and most of the other states rolled it out after Virginia did. We had a lot of clients that had Virginia OSHA come in and inspect their training records, their PPE, their compliance with the Virginia ETS. And all it took was a customer or an employee making an anonymous report.
Oh, wow.
So this stuff will happen with the OSHA piece. Okay. Jill Curtis, yes, I do have religious accommodation request policies, forms, templates that you can use. And I can walk you through that process. So yes, good question. You also are going to need separate requests for medical certifications. Those are the easier ones to approve and review and approve or deny, because the doctor is certifying why they cannot take the vaccine, right? The religious accommodation requests get a little bit more tricky. So under Title VII of the Civil Rights Act of 1964, you have a protected class of religion, okay? Under Title VII, it's defined as a sincerely held religious belief. That's it.
Hmm.
So if I go to Bill Ford at SESCO, and I say, let's assume SESCO's mandating the vaccine voluntarily or required. And I say, Bill, I'm not going to take the vaccine because of my religion. And he's going to say, okay, here's our policy on how you can submit your request for a religious accommodation. Here's the procedure for how it's reviewed. And here's the timeline of when we will review it and circle back with you. So there needs to be policy and procedure and practice in place. Managers should not be reviewing the religious request. It needs to be HR. There's a lot of documentation that has to go along with that, and it needs to be considered confidential personnel information. And so HR has to review that. It is not a situation where you are going to say, oh, you need to bring in a letter from your pastor stating that you attend on this day, or when you join the church, or this and that. No, sincerely held religious belief. They just have to be able to explain why they believe their religion, and just speak to it generally. So a lot of people are out there trying to say, oh, we're not going to provide religious requests. Well, you absolutely have to under federal law. Title VII of the Civil Rights Act mandates that you at least explore a reasonable accommodation. Now, that's not to say that you're going to approve every single one, but you're going to be very, very hardcore pressed to deny a religious request. Because how are you going to counter with somebody's sincerely held religious belief? Okay. So the accommodations are available to healthcare clients, to federal contractors, as well as to regular employers. Again, I've gotten a lot of questions on, well, I'm just not going to provide exemptions. Well, you can't, I mean, you could try, but when you get an EEOC charge of discrimination for violation of Title VII, call SESCO. We're happy to defend it for you. So that's there. Another question on how the 100 is counted, which is a really, really good question. We've gotten a lot of that. So we've got probably plenty of clients on this call, as well as a lot of our other clients that have various locations within the state or even in various states. And maybe I have 10 people here, 25 there, 35 there. There's not 100 at one particular location. Okay. And so we've had employers say, well, do I really have to comply because I am not having 100 at each location? And the answer is still yes. Okay. It is 100 total. It is 100 under common ownership. Okay. So there is no way around that. Sorry.
And you mentioned earlier like something about like what if you have a few that work at home? Does that work into that 100
They
somehow?
still count towards the 100. Yep, they're going to count as bodies. Now there are definitely work from home carve outs, so to speak. So if I work 100% from home and I'm under the 100 mandate or really the healthcare mandate, and I'm not exposed to anything, I would not necessarily be required to get the vaccine. Okay. I still could. But if I'm coming into the office at any point in time, it's game on. You have to have it. Okay. So work from home has a little bit more flexibility depending on how that agreement is structured. So good question. So we've got that piece. The 100 is common ownership, just like it would be for ACA purposes, for family medical leave, for IRS purposes. Even if you have separate federal ID numbers, we are still looking at common ownership under the IRS, the brother sister controlled group. Those sorts of things are going to be in play. So those are great questions. A question about the PowerPoint. Yes, as I mentioned earlier this morning, I will send out the PowerPoint that I use for this as kind of a follow-up, just summary document. Again, knowing that a lot of this is fluid. So the PowerPoint will likely have things in it that are kind of in motion right now or subject to change. So it is not to be considered gospel. So, we had a good question from James about OSHA audits. So James is asking, do we have any indication on how OSHA will audit other than anonymous tips? Yeah, good question. So OSHA reserves the right to show up regardless of whether this is a vaccine mandate or any other safety issue. They can show up with no notice for no reason. They could just be driving by and be like, oh, I want to pop in there and look. Game on. That is how OSHA operates. Now, typically with OSHA, when it's a safety issue, it's driven by a complaint. The other piece that most people don't realize is that OSHA, especially in Virginia, OSHA actually reviews the workers' comp logs each month. So when you have a workers' comp claim, it's submitted to the state, right? And then the state has required mandatory reporting. So OSHA goes through and randomly looks through these workers' comp claims for the month. And that's how sometimes you get random audits that are not complaint driven, because OSHA's like, oh, this business had an eye issue, and a workers' comp claim for debris in eyes. So I'm going to go and look at, do they have an eye washing station? Are they wearing their PPE goggles? Are they doing all of these things? Have they trained people on them? So they do, they're not going to tell you, but they do look at the workers' comp logs each month. And sometimes that drives random visits. But with regard to the vaccine mandate, it's an easy opportunity for them to impose fines with like very minimal work. Very minimal work. Because here's the thing, if OSHA comes in to audit, whether you're, especially if you're a federal contractor or healthcare, there is incredibly robust documentation you are going to have to produce. Vaccine records, copies of vaccine cards, copies of every single medical or religious exemption request, dates of people receiving vaccines, when they were fully vaccinated, copies of policies, who your COVID safety coordinator is, and what their efforts are, and interviews, and all of these things. So it's not just like willy-nilly, if OSHA comes in, that we can just, you can stall them a little bit, but not much, not much. And you certainly don't want to deal with OSHA on your own. And you know, that's always my recommendation with any federal agency, is when you have an audit, whether it's Department of Labor Wage and Hour, whether it's EEOC, OSHA, you always want somebody there that is an expert in employment regulation, that can serve as your advocate. That can guide you through, what do we produce? What do we not produce? What do we say? What do we, more importantly, what do we not say? And then have that expert serve as your agent of record, because that keeps it clean. It keeps it a little less stressful for the employer, for the leadership team, because inevitably, you know, people get nervous. I see it all the time. You know, gosh, I have a Department of Labor Wage and Hour audit going on right now. And the client called and they're like, well, this person, you know, called me and I didn't know what to say. And I got nervous. And I'm like, just, you stop talking. Stop talking. I call it word vomit, right? So people get nervous and they volunteer all sorts of extra information to questions that was never asked. And volunteering that information can then open you up to other areas of exploration. So to James's point, it can be complaint driven, it could be random, but either way, you need to be ready and prepared with your documentation and your record keeping, so that we present it in a pretty little package for them. So that was a wonderful question from James. Let's see, what other questions do we have, David?
I've got one from Jason that says, how do the exceptions work for federal contract healthcare providers?
I'm not sure I understand his, well, are we talking about federal contractors? Or are we talking about CMS healthcare? Or are we talking about both? Because there are differences, but nonetheless, so federal contractors, you can provide an exemption under a medical or religious exemption. However, with those exemptions, that individual cannot work on the contract. So there's a job reassignment. And when I say cannot work on the contract, cannot work anywhere tied to said contract or go onto the contractor site. So with federal contractors, yes, you can provide the exemptions as a reasonable accommodation. However, there's a lot more implications and outcomes associated with those accommodations versus a healthcare CMS mandate. which you can provide the accommodation, and perhaps as a condition of that accommodation, that healthcare provider is doubling up on PPE or doing telehealth instead of being physically in the office. It depends on the circumstances of the particular situation, whether it's a federal contract or healthcare, CMS role, or heck, it might even be both. And then that gets really muddy. Um, and you kind of have to look at each individual scenario and what is reasonable. There always is the option, then again, to, of course, deny the accommodation if it's an unreasonable, um, undue hardship. But again, those are really hard to prove. Undue hardships are really tough.
Now, Jason gave us a little clarification. See if this changes things at all. He said he said federal contracted healthcare providers. So it sounds like a healthcare provider under federal contract.
Would that be a federally qualified health center? It
We'll
could
see.
be a healthcare provider that's contracted through the VA. Again, if they're tied in any way, shape, or form to a federal contract or a subcontract of a federal contract, they're going to have to comply with both. You can provide exemptions, assuming they are reasonable, but also, even with the exemption, they cannot work on the contract so far. Oh, Jason, you're an oh yeah. Yeah. We'll talk more about that. Jason's I'm assuming part of the EMS council. We can talk more about that, or an ambulance service tied to the VA. So, but anyways, I think, Jason, that is a more specific question that would be appropriate to discuss offline about how your organization is even tied to that particular piece. But again, with contractors, they can't touch any work associated with the contract if they're not vaccinated. We'll see if that one gets into the court system. It likely will.
So Jason, I'll just say that if you already have a point of contact at SESCO, by all means, reach out to them. If you don't have a point of contact at SESCO, talk to your insurance sales exec, basically whoever invited you here, and they can get the process started so that we can get you in contact and get those answers going. Jamie, there's another question by Dina. Can you elaborate on definition of common ownership?
Yeah, so there are different definitions under the IRS. There's a brother sister control group, and then there is just a general control group. So let's say, David, you and I own a company, 50-50.
Mhm.
And then you own another company with two of your siblings.
Mhm.
And two of your siblings, all three of your siblings, each own equal share.
Okay.
Okay. Both companies, even though I have zero ownership in the other company, because we're equal percentages of ownership in one and you're equal percentage of ownership in two, it's common ownership. So those companies are grouped together for purposes of common ownership. So you need to look at the percentage of your ownership of your business, what other businesses that you own, and the percentages of those stakeholders in that business to determine whether or not common ownership applies. Again, it may be a moot point depending on how this mandate all plays out, but it's good to know one way or another. And then again, that common ownership is also going to play into healthcare reform, ACA, 50 or more FTEs anyways. So if you're considered ALE, applicable large employer under ACA because of common ownership, it's applying here to the mandate too. So it's a good question.
So is there a percentage? I'm sorry if I missed that, but like if I only own, in that example, if I only own 1% or 5%, is that still common ownership?
Typically it's majority stake ownership, but it depends. There's different ways that the IRS is going to determine it, and it depends on how many shared percentages there are, and do they match with other stakeholders, and it's a little bit more complicated. So it's a good question.
Well, we've got one from Kelly. Do you anticipate that the federal mandate for contractors will end up being applied to all federal contractors, regardless of
Yes.
size? Okay.
Federal contractor is federal contractor, including sub-tier contractors. So my recommendation is prepare now, regardless of how large you are as a federal contractor, because it is interpreted that it already applies to all federal contractors, regardless of size.
Gotcha.
Yep.
And Michelle asks, we are government contractors and just hired a new employee that has religious exemption. We have less than 100 employees. She will
Okay.
be on base and has agreed to weekly testing and mask mandate. I'm requesting clarification of her working on this contract.
Okay, so if you're a government contractor, you're covered under the government contractor mandate. The 100 mandate means has zero merit here. Doesn't matter. So if you're a federal contractor or you're covered underneath the CMS, you comply with those two. You don't worry about the 100 ETS mandate. Okay. It's only for private employers that are not contractors, that are not CMS covered under that executive order. Remember, those are separate regulations. So the federal contractor and the CMS were issued via executive order from the president. The 100 is through OSHA. So the federal contractor and the CMS regulations are actually more stringent than what OSHA issued. So therefore, the federal contractors and the healthcare CMS folks comply with the more stringent regulation. Okay. They comply with the executive order, not the OSHA mandate. Does that make sense?
She said thank you, so I think it does.
Yeah. Okay. And see, this is why things get so complicated. It's because you've got three different mandates, and clients are like, "Well, which one do I work on?" And I'm like, "Well, which one do you fall under?" Sometimes they're both. Sometimes it's all three. Excuse me. So it is tough. James, OSHA will go off IRS guidelines and not work comp guidelines. That is correct. That is correct. Common ownership, IRS rules, not workers' comp. Workers' comp is state related. Yep.
And I'll echo just the OSHA just real quick. We suddenly had three contractors, general contractors in one particular town get cited for OSHA violations, and everybody was trying to figure out why, because we've never really had any in this area. And we found out that an OSHA inspector had moved into the area and that he just happened to live there. And so, yes, there was no real reason, back to your point, for that. There was no, like, he just happened to be driving by, saw him, stopped by it, and
Bingo.
inspection. Yeah.
Oh, I mean, I've had, and typically, regardless of federal agency, they're not supposed to, let me clarify, they're not supposed to tell you why they're there or how they ended up there. Okay. So if you get like a wage and hour audit, they're not supposed to tell you, oh, somebody made a complaint or what have you. But again, sometimes you get that one investigator who either is on their way out in retirement or they're just really, really super casual. And they'll be like, I just popped in. I happened to be driving by and I thought I'd stop because I was curious. There was no complaint. And sometimes they're brutally honest with you. And I appreciate that as a consultant because I'm like, okay, well, that makes me feel better. Like at least if it's random. But yeah, I mean, it happens. I've had clients, I had a huge home health client that had 8 different locations spread out between Eastern Shore, Fredericksburg, Richmond, Chesterfield, out towards like Lynchburg area. And they got a random audit from the wage and hour division out of the Fredericksburg office. And, one of the first things that we do is like, okay, who did you fire? Who's complained about wages, et cetera, et cetera. And that investigator was openly honest, and she was like, "My office is literally in the same building around the corner, and
Mm,
that's why I chose you all, because it
mm.
was convenience." I'm like, "Well, there you go." So,
Let's see. Michelle asks, I'm the HR admin for a large restaurant group. And so I'm going to assume over 100. If we require the vaccine mandate and
mhm.
allow exemptions, what is the requirement for weekly testing?
That would be part of the reasonable accommodation process, as well as the OSHA mandate. So weekly testing, every 7 days. It's 7 calendar days. So my recommendation there is if you're going to do weekly testing, um, pick a day, like Monday, Tuesday, Wednesday, whatever, so that from an administrative standpoint, we can manage it.
Mhm.
Everybody needs to bring in a test, or we're going to administer your rapid test on site Monday between the hours of 8 and 10. And you're not going to be able to show up for your shift until that test is negative. The other interesting piece is people that test positive actually will not need to retest for a
Mm,
certain length of time because they'll continue to test positive. Does
mm.
that make sense?
Right.
So if you've had COVID, it stays in your system and you continue to test positive for like the next 90 days. So with the weekly testing, it's going to have to be every 7 days. Employers have two options, really. So they have the option of providing the test themselves. You can go to Sam's Club, you can go to Costco and buy the nasal swabs. You can contract through Patient First or BetterMed or what have you to do it and outsource it. Um, there's still some snags on testing in terms of being able to get a test
Mhm.
and get reliable results. So the regulations do provide for both rapid as well as PCR testing. However, if you are going to allow your employees to self-test, meaning I go to CVS and I buy that nasal swab and I test myself and I bring it in, they cannot both self-administer and self-read. Okay. So they can administer it themselves, but somebody in the company has to read the results. There has to be a checks and balance system and that's required as part of the regulation. Okay.
Mhm.
So, my recommendation, bring it in house, do it yourself, buy the test in bulk, have a designated testing individual. You're going to have to record the results. The results have to be stored in a separate medical file for that person, not in like a bulk, oh, these 50 people are getting tested weekly. It's got to be Jamie's test results and Jamie's separate medical file each week. Um, so, there's some administrative pieces that employers need to work out and have ready to roll if we have to start doing weekly testing.
So I'm gonna ask a question that several business owners have asked me along that same line is who pays for it? Like who's obligated to pay? I mean, is this like can we request the question has always come back to can we request reimbursement to the government? Do we require the employee to pay for it or does the business have to pay for
Good question. So, um, technically, the employer does not have to pay for the weekly testing. You can push that back to the employee. Um, Most of my businesses are just saying, we're just going to do it ourselves. Because then it's a control piece. We know that it's administered properly, that we know that it's done well. If they don't show up for the test, too bad, they're not coming in that week. But then that opens up issues of staffing levels in a short labor market as we already are in. So, um, you know, they can certainly pass the responsibility and the cost to the employee. Um, but the company can also pick it up. But there's no reimbursement from the federal government.
it? Okay. So
Now, I mean, in theory, if you have employees that are on your medical benefits, technically if they're on the insurance plan and they go to get tested at a facility, CVS, Walgreens, wherever, the insurance should cover the medical test. Now, is the insurance companies, will they start carving out, we're not going to cover weekly testing, we're only going to cover it when you're demonstrating symptoms? We'll see what the carriers do, but nobody's addressed that yet.
So Dina asks a question that says, is there any certification or training to administering a test? She mentions liability of one employee administering test on another. I guess that's a concern, liability regarding one employee doing a medical test on another. What are your thoughts there?
Yeah, no, I think that's a good question. I'm sure there is certification out there. Certainly, you don't have to be administering the test. You could simply be social distance and PPE, and the employee can swab their own nose. And they can process it and wait for the results, and then the other employee is certainly just there to verify the results. So again, it goes back to what works for your organization. What level of risk are we willing to assume? If I have some companies that somebody is the designated testing individual and they are loaded up in PPE, and there are safety barriers in place and whatever, and that's what worked for that client. And I have other clients that are like, nope, you have to go do it on your own, and you need to bring me a copy of the results each week by Monday at 8 a.m. or else you're not coming in. So again, you've got flexibility there. So
let's see, that's the end of at least end of the current questions that we have posted.
Yeah, good questions. Very good questions. I think as businesses, we just need to use common sense. Figure out what it is that we want to do. Do we want to comply? Do we not want to comply? Do we want to kind of wait and see? And that's a business decision only the business owner and the leadership team can make. And then you go from there. There are a lot of organizations like SESCO out there that have resources ready and available to help support you with your compliance efforts and to guide you through those weird situations as they arise or requests for medical exemptions. I've got a client that's like sending me every single religious request, and he's like, can you look at this? Do I approve it or deny it? And that's fine. So, again, it boils down to risk. But what are we willing to risk, and for how long? And again, business decision. But ask the questions, partner with the right people, because you want to make sure that if this stuff does roll through, that you guys are ready. I always hate to see companies get dinged for kind of waiting and seeing, because it's unfair. I mean, it's hard enough to run a business as it is, for a variety of factors, between short workforces, the Great Resignation, compensation challenges, cultural challenges. I mean, there's so much going on right now. Plus, throw in the holiday season. Everybody's tired. Everybody is tired, and it's been a lot. It's been a lot on businesses, on HR individuals, on managers in general, and employees. So, you got to kind of just take a breath, figure out what it is that we want to do, and make sure that we've got the necessary support in place for whatever that looks like.
Okay. That's great. I appreciate it. I just want to reiterate that, well, if there are any other questions, by all means, go ahead and post them. But, and just wanted to take this time to reiterate, hey, listen, if you are a client and you do not have a relationship with SESCO yet, by all means, reach out to your sales executive, and they will get the process started. If you're not a client, this is me just in marketing going, hey, let us compete for your business, and let us help you, and reach out to whoever it was that invited you, and in that regard. If there are no other questions, any other thoughts, Jamie? Closing remarks?
No, I don't think so. I think, we certainly will keep everybody apprised of what's going on. Again, if you're a banker's client, and you are enrolled in the SESCO program, that provides you with just basic access to SESCO to ask initial questions. There is an ability to, obtain additional support. And certainly that can be explained between you and the consultant that you're working with, based on your particular needs, because everything is customized. But so if you're enrolled in that program, you should be getting the SESCO e-blast, the newsletters and all of that. So we keep everybody informed of what's going on. Also, the SESCO website is a really good resource tool. There's a COVID-19 tab at the top that kind of also mirrors updates and templates and resources there for you. So use that. As David mentioned, if you don't know what we're talking about, reach out to your account rep, and they can kind of explore that with you. So hang in there. I know it's a lot going on, rolling, especially with the holidays coming up. But if we can be of any assistance, certainly let us know. And David, as always, we appreciate the opportunity to chat with bankers, and it's been a nice long relationship.
It has been. Thank you. Thank you for your time. And again, thanks to everyone who attended. If you have any questions, reach out to your sales rep. We'll do our very best to get you in touch. And thanks again, Jimmy.
Thanks. Y'all take care. Have a good day.
Bye.